One of the key processes in place is a system of risk management, risk assessment that's been taken care of when you get involved in large projects or when you have certain standard operation in the organization, like a shutdown of a major plant. You generally do a risk assessment, and you have a matrix of all the issues that can take place, and you have issues that are never heard of in industry. Issues that are heard of in industry, for instance, the Fukushima incident. Yes, that was heard of in industry because it happened before in 3 Mile Island and in Chernobyl. So you would rate the Fukushima incident here, and you can then look at the severity. No health on the left-hand side. No. Now, see, this should work. Yeah, the severity is a very low severity with no health effect or injury, or a very high severity with multiple fatalities on the bottom side. Now, each standardized operation, you make a risk assessment, like a shutdown of a plant or whatever. And you have risk assessments throughout the organization, and you then take appropriate actions. It's very clear that if you end up sometime in this red area, you have to continuously monitor and check and work the issue. When it's yellow, you still have that under constant surveillance, and when it's blue, you do more or less incidental checks. You still keep a watching eye, but you have standard procedures in place at least to take care of that situation. I would say that the Fukushima situation is somewhere around here at the moment, somewhere around here. Like there will be multiple fatalities around there, as is likely, and it's heard of in industry before. And it has had to be in a situation of continuous surveillance of systems, whether they were in place or not. And time will tell what the real problems have been. But it's very clear that many people around the world are trying to learn from such an incident. And that is a process, and I would recommend that to people in the hospital or the health world as well. Make a standard thing of learning from others. And openly discuss things and then learn from others to how you can do things better. That is the real only approach on how you can ensure that the statistics not only improve, but that patients feel comfortable that this is a place where they're being safely treated and they're properly taken care of. The other thing in place is what we call Health and Safety Management, HSEMS, Health and Safety and Environment Management System. In a company like Shell, we all describe things in the tripartite health, safety and environment as issues that management has to manage very clearly. That management system has to be in place in a refinery, in an office. And as Wim reported in the early statement, yes, we have a simple thing. When you have railings, why not use them? And we found too often that in factories where you have these metal railings and operators walk around in their heavy boots and their heavy gear, yes, we ask them to hold those railings because it helps them, it avoids them not falling, having one grip. There is the general tendency of people want to do things right and work hard and have their hands full of things and then walk up the stairs. We have noticed that it has prevented a significant number of falling incidents when people hold those railings. And an interesting story, when once the real CEO of Shell globally and myself walked down the stair at the start of an analyst meeting, and the photographers became in one of the Dutch papers. Some of the operators in our operations in Nam and Groningen saw this photograph of the two of us with a piece of paper in our hands in this large stair in the Shell office in The Hague, not holding a railing. And yes, we had worked in this office environment where we said, well, this is not a plant environment, and you don't think about it. And we got this email from the operator, and they said, Mr. Willems, what's good for us? Is that not good for you two guys? And they were that right. So I immediately said back, you're absolutely correct. And I will make sure that in this office you have the same rules as you have in the plants in Groningen. So yes, we then did follow that. And I had to convince people in the Hague office, and it's typical of an organization. We said, yeah, but it's not a factory here. We don't have to work like that here. And I said, well, if we want to show an example and that this is the culture in an organization, we have to do it here as well. Because these people who work here will go to factories as well, will give advice to people, and they have to realize that it's the same simple rules that we use here. It's a simple story that I tell you here, but it shows you that it has to do with the culture of an organization.